Today we are going to talk about cystitis and urinary tract infections. Specifically, cystitis is divided into two. We have the first part, which is called cyst, and then titis. Titis simply means inflammation, and cyst means a fluid-filled sac. So when you look at the urinary bladder on ultrasound, you realize that it actually just appears as if it is a cyst, and that's why the infection of the bladder is called cystitis. Cyst means a fluid-filled sac. In this case, it is the urinary bladder, and titis simply means inflammation. Inflammation is the body's reaction to injury. So specifically, when you are feeling pain, we are feeling discomfort, it means there could be a problem. So without further ado, we are going to talk about urinary tract infections. Gerard Massa, the health educator, is the name of the channel. Welcome, and I'm really so happy to connect with you today. And please give me just a few minutes. We are going to talk about the tips of how to manage a urinary tract infections. And without further ado, we shall go to tip 1. Tip 1, just make sure that you take plenty of water. When you take plenty of water, the infections, the disease-causing organisms will be flushed out of the urinary system and they will be passed out. When they are passed out in large quantities, then it means you will be free from urinary tract infections. The next tip is just make sure that when you go for long call, you should wipe from the front to the back. Make sure that you wipe from the front to the back. The main reason is that when you look at the rectum, there are bacterial organisms, there are disease-causing organisms. More specifically, there is one called E. coli. E. coli is a harmless bacteria that lives in the rectum, but when you do long call and you wipe yourself from the back to the front, there are high chances that you can transmit or you can transfer this disease-causing organism from your rectum to your urethra. The urethra is that tube through which urine passes. So tip number 2, make sure that when you go for long call, always wipe from the front to the back and not the other way around. And thanks a lot. Gerard Massa, the health educator, is the name of the channel. Thanks a lot for connecting with me, and we are going to tip 3. The third tip you need to do is you should make sure that whenever you feel the urge, just make sure that you go and urinate. You go and urinate whenever you feel the urge. Do not hold on to urine. Do not hold urine for long hours, because the more you hold, the more it can cause damage to your urinary system. So whenever you feel the urge, go and urinate. Our next tip is consider putting on underwear or underparts that are cotton in nature. Whenever you put on cotton underwear and underwear which is not so fitting, which is not so tight, then it is very important because it can help out in the prevention. So put on loose underwear, and then when we shall go to our next tip, and our next tip is make sure that whenever you feel the symptoms of UTI, seek medical advice urgently, because this can always go into complications. We talked about the symptoms of UTIs, and we need to understand what are these symptoms. So our next phase is what are the symptoms of UTIs. The first symptom of UTI that is very recognized, which is like worldwide, it is frequency, urgency in urination. When we talk about frequency, you do feel like you want to urinate a lot. You urinate many times and the frequency is increased. So whenever you are going for a short call but you are urinating many times, that is increased frequency, then it could be a sign that you could be having a urine analysis. You could be having a urinary tract infections. Sorry about that. Our next symptom is there's urgency. You feel like you want to urinate, but there and then you just rush. You actually cannot hold urine for long hours. The next symptom is there is what we call dysuria. Dysuria is very common. Dysuria simply means difficulty passing urine. There's that burning pain, there's that stinging pain you feel whenever you're passing out urine. So we've talked about the symptoms of UTIs, and we've talked about the frequency, we've talked about the urgency, we've talked about difficulty passing urine. The next symptom of UTI is that you actually begin have experiencing issues with your sex life, and specifically in men, that motivation and the urge and the libido tends to come down. It tends to decrease. The main reason why the libido decreases is because there's damage to the surrounding structures through this UTI that is increasing, that is growing in its the increase of the UTI in your system causes damage to your other organs, specifically the prostate gland. The prostate gland can be damaged by prolonged UTIs or repeated UTIs. So whenever a man is feeling decreased libido, then there could be problems with their prostate gland. Maybe it could be increasing in size, or it could also be having a tumor, or a tumor is basically a growth, or specifically the UTI could be even affecting the sphincter muscles. The sphincter muscles are those muscles that hold the urethra in place. So we've talked about the signs and symptoms of UTIs. We shall talk about the tests for UTIs. What are the tests that can be done to confirm that this is a UTI or it's not a UTI? Thanks a lot for staying with me. The channel is Gerard Massa, the health educator. I'm really so happy to talk to you. Remember to leave your questions down below in the comments, and please just make sure that you share this video with all our friends so that they can get this message. We are talking about the tests that can be done to confirm that you could be having a urinary tract infection. The first test that can be done yes, we are talking about the tests that can be done to confirm that you could be having a urinary tract infection. The first test that is done, the commonest test, is called the urine analysis test. The urine analysis test is that test that looks at your urine in 3 parts. Specifically, the first part is macroscopically how your urine appears in the container, and the next part is biochemically, that is under biochemistry analysis. We look at the different parameters of your urine, and then of course microscopically we look at your urine under a microscope. Macroscopically, the urine may be yellow, it may be turbid, it may be having some residues, it may actually be having a color that is reddish. You get the point? That is the macroscopic appearance. And then the biochemical analysis, or looking at your urine biochemically, specifically we use a dipstick, a urine analysis stick, dipstick, and then under biochemical analysis we look at cells called leukocytes. Specifically, when there is presence of leukocytes or white blood cells in your urine, then it means there could be something damaging or causing these white blood cells to be produced. And this something we are looking at is the urine test, the urine bacteria. It can cause the white blood cells to appear. The next is there will be changes in the pH. The pH is the potential of hydrogen, or the acidity or alkalinity of your urine. So normal pH is supposed to be 3 up to 6.5. Whenever there are changes in your pH, then it means there could be something happening. And the other confirmatory case, for the other confirmatory test under biochemistry analysis when we are testing your urine, is the presence of nitrites. Presence of nitrites in your urine gives us a clue that you are having a urine infection. And the next is we also look at the SG, or the specific gravity. The specific gravity is the heaviness of your urine. Normal is supposed to be 1.000. So whenever you do the urine test and your results are higher, maybe it is at 1.025, 1.030, then that means there could be something causing the increase in the specific gravity. There are other parameters, for example, bilirubin, urobilinogen, proteins, and blood. All this can be done by your doctor whenever you are feeling the above symptoms we talked about. That is the frequency, urgency, difficulty passing urine. You pass out urine but you feel that burning, stinging pain, then just make sure that you go see your doctor. They will do all these tests. Treatment for UTIs, many times treatment is supposed to be prescribed to you by your doctor, and the commonest drugs that will be given will depend on the tests that have been done. So whenever your tests show that there are issues with their changes, maybe there's lots of white blood cells, there's lots of changes in your acidity, then antibiotics can be prescribed. Now we are not going to talk about the antibiotics here, but just know that your doctor can prescribe you the antibiotics. Antibiotics are drugs that handle infections. Just make sure that you go to your doctor and then they will prescribe for you the antibiotics. These antibiotics should not be misused. Please do not self-medicate, because the danger is when you take plenty of antibiotics on yourself, when you do self-medication with antibiotics, the danger is that time can reach when your body no longer responds to these drugs. This is called tolerance. So whenever your body tolerates these drugs, it actually is also called compliance. Whenever your body complies with these drugs and it gets used to these drugs, the antibiotics, time can reach when your body may not be able to respond. So just make sure that you always see your doctor. They do these tests we talked about, and then the specific drugs can be given. But the tips we talked about will play a very big role, and the tips we talked about in the beginning, they include: you should make sure that you drink plenty of water, you should wipe yourself from front to back whenever you go for long call. The other thing is you should take some cranberry juice, but cranberry juice should be taken with caution, because if you are a patient with kidney stones, please do not take cranberry juice. The main reason is cranberry juice contains oxalates, which may worsen your kidney stones. So when you don't have the kidney stones, then you can take the cranberry juice. This can be got from your nearby pharmacy or your nearby supermarket. So take plenty of cranberry juice. It will help with your UTIs, but take caution not to take when you have kidney stones. The other thing we talked about is just make sure that you put on loose clothing. Do not put on very tight clothing, and also avoid nylon underwears. They are not really the best. So thanks a lot for staying with me. Remember to subscribe to our channel, Gerard Massa, the Health Educator. Add me on my WhatsApp. My WhatsApp number is +256 701 797876. Remember, it is +256 701 7978 and 76. Connect with me. Remember to download and share this video, share it with our friends so that more of our friends can get this information. I'm really so happy that you spared some time so that we could share this. Have yourself a fantastic and healthy day.